So right after surgery to the time I see you back in the clinic 1 week later, patients often wonder, well, what is that like? Is it painful? Am I able to walk? Well, patients, I think, are usually surprised at how quickly they are able to get back to activity. Usually after surgery, you spend about an hour in the recovery room. The nurse there will acquaint you with the drain, the catheter. If you have some pain from the procedure, they'll give you some IV pain medication. And then by the time you come to the floor, your family will be there, and the nurse on the floor will meet you. And that evening time usually will be the first time you can get up and start walking. You'll have an IV with you, so there's an IV pole as you walk around. I don't really get rid of the IV till the following day. That's because patients are still recovering from the anesthesia, and we don't want you to eat too soon. By the next day, though, most patients aren't taking any more IV pain medications. They have a drain, which is there just as a precaution. We're able to remove that drain usually on day one. It's not that painful. The last thing is the catheter, and we'll make sure you learn how to take care of the catheter. It's very easy to drain the bag. There's a bag that you can wear on the leg. You can wear trousers so people don't have to see it. And during that week, patients are able to walk, take stairs. Really, they can do anything they want to. I tell patients to wait 48 hours before taking a shower, and to just not do anything silly like trying to lift anything heavy. If you feel abdominal strain, that's probably too much. You can take stairs. I'd rather you not drive if you can help it, just because the potential liability of having a catheter in. I've never had that situation arise, but why risk it during that first week from surgery? And then when you come back in for your follow-up, we'll make sure everything looks okay with your incisions, and then we'll start going over some of the rehab process that we're going to start again. The urinary control exercises, the pills and medications for sexual function. We'll remove the catheter in the office. Everyone's always excited to get rid of the catheter, even though when we ask them, was it painful, no one really even needs to take a pain pill because of the catheter. And the catheter comes out pretty easily in the office. We'll go over the pathology report, make sure you're clear on everything that you can and you shouldn't be doing, and then we'll see you back in 3 months.